Good evening, doctors. Welcome again. Today we are going to discuss about emergency medicine. Let's start. I already put first part. This is our second part. You are at the scene of an MVA in which there are three patients, all of which have minor visible injuries. Two are refusing treatment, and the last is complaining of neck and back pain. How should you proceed? In such case, obtain signed refusal from the first two patients, then proceed to the third. Okay, your patient is at 17-year-old male found face down in a swimming pool. He is currently being held up face up at the surface of the water. He is unconscious but breathing and has a pulse. What is the best course of action for this patient is apply cervical and spinal immobilization while the patient is still in the pool. Okay, now a laceration is spurting bridge. A laceration spurting bright red blood most likely means what type of injury? Red blood most likely the means which type of injury, that is arterial. Your patient has a laceration to the right leg which has intersected the femoral artery. You have applied direct pressure to the wound but it continues to soak through the bandages. What should you do next? Apply pressure point just above the injury. Of the two types of energy transfer, which type of energy transfer is a motor vehicle crash with frontal impact, non-restrained driver with band, steering wheel and spider windshield transfer? Which type would you motor vehicle crash with frontal impact, that is blunt? Any penetrating missile traveling over 2000 feet per second would be classified as high velocity. When there is a penetrating trauma, there is a permanent cavity which is formed by the projectile contacting the tissue. How is temporary cavity formed? By energy scrubbing of the projectile. The way a patient is injured is referred to as the mechanism of injury. When approaching a scene of trauma incident, what is your first order of businessman? That scene safety. A large collection of blood under the skin is known as hematoma. Your trauma patient has her left hand caught between rollers of conveyor belt. Extrication takes 30 minutes. Evaluation of injury during extrication showed delayed capillary refill distal to the injury. The post extrication shows rapid capillary refill distal to the injury deformity mid palm. There are no obvious fractures, no lacerations, and minor swelling. Knowing that crush injuries can cause many other problems, which is not considered as a crush injury complication. No injury at all. Loss of tissue in a traumatic event can be just soft tissue, a portion of an extremity, or an entire extremity. If your patient has lost the distal one third of lower extremity, what would the injury be called? Amputation. In any traumatic event where there is a tissue damage that cause bleeding, the bleeding needs to be controlled. What is the proper steps to bleeding control? Direct pressure, digital pressure, elevation, and tourniquet. Okay, now a 16-year-old trauma patient has what appears to be mid-shaft femur fracture. You notice that there is a laceration directly over the suspected fracture. Bleeding is controlled. What type of fracture would be this? Open. You arrive on the scene of a patient who fell from a ladder. Which of the following is not information is not an important factor care of the patient? Height of ladder was correct. The height of ladder is unimportant in your assessment as the patient may not have been at the top of ladder when he fell. Okay. All patient refusal must be informed refusal and in writing. If you treat all three patients even through the refuse, they guilty of battery. 17-year-old male found to face swimming pool. He is currently being held up face at the surface of water. He is unconscious but the breathing and his pulse. What is the best course of management? Now we are going to discuss explanation of our answers. Your my answer is apply cervical and spinal immobilization. So because you do not know what caused the patient became unconscious, spinal precaution need to be taken. Okay, this is the explanation. Laceration, spurting, bring laceration, red blood most likely means what type of injury? The red blood most likely is a type of injury. I answer arterial. That is right. The bright the blood, more oxygen it holds. Since arterial blood comes from the heart, it is rich in oxygen. Okay. Explanation. Your patient has laceration of right leg which has intersected the femoral artery. Apply direct pressure to the wound, but it continues. So the bandages you should do. Apply pressure just point above the injury was incorrect. Elevate the leg is the answer. Elevate the leg above the heart can help control bleeding. If that fails, next step would be the pressure point. So our answer is next step. First step is elevate the leg. Okay. Why? Because the bleeding comes from upper side. If two types of energy, which type of energy transfer from motor vehicle crash in frontal impact, non-restrained driver with bent straining wheel? So our answer is blunt was correct. Blunt is not limited to just getting stabbed or shot. Blunt trauma is any injury which is caused something penetrating in a human body and having energy transfer to the human body. Blunt trauma can be caused by declarating injury like front and impact the car against a tree. Any penetrating missile traveling over 2000 feet per second, it is our answer is high velocity, and projectile which traveling greater than 2000 considered as high velocity. Okay, I hope you understand. Where there is penetrating trauma, there is a permanent cavity which is formed by the projectile contracting the tissue. How is a temporary cavity formed? By energy scrubbing, okay, of the projectile was correct. Now, the way of patient injured is often referred to the mechanism of injury is our answer is right. Approaching the trauma incident, what you first order to do businessman is scene safety. If someone is fall between a road, so you have to make the scene safety firstly. Okay, no need to start CPR in between road. A large collection of blood under the skin is known as hematoma, as I already explained. Your trauma patient has left hand caught between roller and roller, so no injury at all was correct. Loss of tissue in traumatic event can amputation was correct. In any traumatic event where there is a tissue damage that cause bleeding, bleed needs to uncontrolled. What is the proper step? Direct pressure, distal pressure, elevation to negate was correct our answer. This is open fracture, I already explained, right? Now let's discuss another important question. Patient with often present with altered mental status, seizures, and even coma. That is hyperosmolar hyperglycemic syndrome, not DKA. I will explain you why. Patient with either of these hyperglycemic crisis, TKA or HHS, often present with fatigue, polyuria, polydipsia. The examination appear they are dehydrated on examination with dry mucous membrane, tachycardia, and severe cases hypotension. The patient with HHS often present with altered mental status, seizure, and even coma, while the patient with DKA typically only experience change of mental status is the most severe cases, according to the review article published in Emergency Medicine. Okay. True or false, infection is one of the most common precipitating factors in both DKA and HHS. Yes, this is true. Yes, explanation infection is one of the most common precipitating factor in both DKA and HHS. The five causes of DKA and HHS can be remembered. First is infection. So infection for both infarction, infant pregnancy, indiscrimination, and lack of insulin, according to review published online. Okay. Now, true or false, a patient are much more likely to be die from precipitating event that cause DKA or HHS hyperglycemic crisis itself. Yes. Why? Both DKA and HHS are usually triggered by an underlying illness or event. Therefore, clinical should always focus on identifying precipitating cause such as acute infection, stroke, and MI, as some require immediate treatment. In fact, DKA or HHS is rarely the primary cause of death. Patients are much more likely to die from precipitating event that causes DKA or HHS. According to the information cited in review, the article published online. Okay. Now, a patient with DKA or HHS who are the highest risk for poor outcome include at the extremes of age, who have severe comorbidities, who are hypotensive A and B, or it's all three ABC. Patient at the highest risks of poor outcome include those are extremes of age who have severe comorbidities, who have underlying infection, who are hypotensive or in a comatose stage, according to information cited. Okay. The extent of DKA disease severity can be determined by analyzing the patient is mental status, PS serum, serum bicarbonate level, and all is the right answer. Mental status and PS serum bicarbonate level help clinicals determine the extent of disease severity, classifying patients as having mild, moderate, or severe DKA according to information cited in the review. Okay, I hope it's clear for you till here. And if you have any queries, any question regarding this emergency medicine, you can ask me in exam. In any exam, there is a at least 10 5 to 10 MCQs from emergency medicine, so please revise it. This will help you a lot. Thank you. Good day, goodbye, and that's all for today. And if you still not subscribe my channel, subscribe it. Good day, good